Did you know that some common medications, ones you or your loved ones may take every day, can actually harm your memory and brain health? Have you ever wondered if the pills you rely on to manage certain health conditions might secretly be contributing to cognitive decline? What if you could identify and avoid these medications, ultimately safeguarding your brain and improving your quality of life? Recent research has revealed a startling truth. Memory loss is not an inevitable part of aging. While it's widely believed that growing older naturally leads to cognitive decline, science now shows that this isn't always the case. In fact, certain medications, especially when used without proper guidance or for extended periods, can have significant adverse effects on the brain. But why do some seemingly harmless drugs cause such severe damage? And more importantly, how can we protect our brains while still treating other health conditions? Stay with us as we explore 8 medications that can damage memory and the brain. Information that could make all the difference in your long-term cognitive health. Make sure you watch until the end, because medication number 7 is the most dangerous and almost no one knows about it. All the references used to create this video are listed in the description, so you can access them whenever you want. Let's get started. First, let's set the stage by understanding aging and dementia. For a long time, it was believed that dementia and cognitive decline were simply unavoidable as we grow older. However, recent research challenges this outdated perspective, revealing that memory loss is not a normal or inevitable part of aging. Dementia, including Alzheimer's disease, results from specific pathological processes that affect the brain, not simply from advancing age. Studies show it's possible to keep cognition sharp and even improve certain skills over the years, as long as risk factors are managed properly. Elements that contribute to brain health in old age include a balanced diet, regular exercise, mental and social stimulation, and the management of chronic conditions like hypertension and diabetes. But there are also lesser-known factors that can trigger or worsen cognitive decline. Alcohol abuse, smoking, brain injuries, strokes, chronic insomnia, and persistent stress are all widely recognized as negative influences on brain health. Additionally, nutritional deficiencies, especially of vitamin B12, and psychiatric disorders play critical roles. Our understanding of dementia has advanced significantly, highlighting the importance of certain proteins, like tau and beta amyloid, in forming tangles and plaques that damage brain cells. Genetic factors can also predispose certain individuals to develop dementia, although environment and lifestyle can significantly modify these risks. Preventing dementia involves a multifaceted approach, promoting a healthy lifestyle, controlling chronic diseases, and sometimes using medical interventions. Ongoing research continues to explore new therapies that may slow or prevent the progression of dementia. Recognizing that cognitive decline is not an inevitable part of aging can inspire changes that promote brain health throughout life. Now, let's discuss some surprising factors that contribute to memory loss. Memory loss is a complex phenomenon resulting from a variety of causes beyond aging and neurodegenerative diseases. Some of these factors may be hiding in plain sight. Substance abuse, such as alcohol and tobacco use, is a significant factor. Alcohol can cause direct brain damage, while tobacco contributes to vascular problems that affect brain health. Traumatic brain injuries, often resulting from accidents or contact sports, are also common culprits. These injuries can cause immediate damage or lead to long-term cognitive problems, such as chronic traumatic encephalopathy. Strokes are another major cause, as they interrupt blood flow to the brain and result in damage that affects memory and other cognitive functions. Insomnia and sleep disorders have a direct relationship with mental and cognitive health. Chronic sleep deprivation interferes with memory consolidation, making it harder to retain new information and retrieve existing memories. Chronic stress is also harmful, as the stress hormone cortisol can damage brain structures involved in memory, such as the hippocampus. Nutritional deficiencies, especially a lack of vitamin B12, are another lesser-known cause of memory loss. Vitamin B12 is essential for neuronal health, and its deficiency can lead to significant neurological symptoms, including memory loss and mental confusion. Psychiatric disorders, such as depression and anxiety, also affect memory. Depression can lead to decreased concentration and recall capacity, while chronic anxiety can interfere with the brain's ability to process and store information. In summary, memory loss can be influenced by a combination of factors, many of which are preventable or manageable. Awareness and proper management of these factors can help preserve cognitive function throughout life. But perhaps the most overlooked contributors to memory loss are certain medications. Many commonly used drugs can have adverse effects on memory and cognitive function, a fact often unknown to patients. These medications, while effective for treating various health conditions, can have significant side effects, including the deterioration of memory and other cognitive functions. Let's dive into the 8 medications that can damage memory and the brain. Understanding these risks could be life-changing. First on our list is omeprazole and its hidden dangers to the brain. Omeprazole, a widely used medication to treat conditions like heartburn, belongs to the class of proton pump inhibitors, PPIs, which also include lansoprazole, pantoprazole, and esomeprazole. These medications effectively reduce gastric acid secretion, providing relief from reflux and gastritis symptoms. However, prolonged use has been associated with serious risks to brain health. Epidemiological studies indicate that continuous use of PPIs is linked to an increased risk of dementia and memory loss. For example, a study involving about 6,000 people showed that 10% of participants who took omeprazole for more than 3 years suffered memory loss. Another study found that 33% of patients who used the drug for more than 4.5 years reported cognitive disorders. This connection may be related to decreased absorption of vitamin B12, a crucial nutrient for neurological health. B12 deficiency can lead to neurological and cognitive disorders. Additionally, PPIs can alter gut microbiota, which can negatively impact brain function. The over-the-counter availability of omeprazole means that self-medication is common, but it's vital that patients consult their doctors before starting prolonged treatment. Accurate diagnosis should precede prescription, and generally, PPI treatment should be limited to 2 weeks to 3 months, depending on the condition. Besides cognitive risks, prolonged use of PPIs can lead to vitamin deficiencies, kidney diseases, bone fractures, and an increased risk of infections. Therefore, cautious use and strict medical supervision are essential to avoid long-term complications. Second, let's talk about anticholinergics, the dark side of popular medications. Anticholinergics are widely used to treat conditions like Parkinson's disease, overactive bladder, and certain respiratory disorders. They work by blocking the action of acetylcholine, a crucial neurotransmitter for memory and learning. Although effective, these medications can have significant adverse effects on the brain, especially with prolonged use. Studies show that anticholinergics are associated with a substantial increase in the risk of dementia. Research from the University of Washington, which followed more than 3,500 elderly people for 10 years, found that those who used anticholinergics regularly had a 54% higher risk of developing dementia. The risk increased with higher doses and longer use. Common anticholinergics associated with cognitive decline include scopolamine, mecamylamine, atropine, bipyridine, oxybutynin, trihexyphenidyl, and benztropine. These drugs interfere with neuron communication, impairing memory and learning. Interestingly, some anticholinergics, especially those administered by inhalation, have not been linked to these adverse effects.
The indiscriminate use of these medications, particularly among the elderly, is concerning. Patients and doctors must carefully weigh the risks and benefits, seeking alternatives when possible and limiting use to the minimum necessary. Third on our list are corticosteroids, when treatment affects your brain. Corticosteroids are powerful medications used to treat a broad range of conditions, from asthma and allergies to autoimmune and inflammatory diseases. However, prolonged use, especially when taken orally, is associated with serious adverse effects, including deterioration of mental and cognitive health. Studies have shown that corticosteroids can cause structural changes in the brain, leading to problems like disorientation, confusion, depression, and anxiety. An epidemiological study in the UK, analyzing data from over 500,000 people, found that long-term corticosteroid users had a significantly higher risk of developing dementia and other mental health disorders. Glucocorticoids such as prednisone and dexamethasone are particularly concerning when used long-term. They can interfere with brain function, possibly due to changes in cortisol levels, a stress hormone that, in excess, can damage neurons in the hippocampus. Even inhaled corticosteroids, considered safer, can have negative impacts in high doses or with prolonged use. To minimize these risks, corticosteroid use must be carefully monitored by healthcare professionals. Patients should use the lowest effective dose for the shortest possible time, and non-pharmacological management strategies should be considered whenever possible. Fourth, benzodiazepines, the silent risk to memory. Benzodiazepines are a class of medications widely prescribed to treat anxiety and insomnia, known for their calming effects. Drugs like alprazolam, diazepam, and lorazepam are effective in quickly relieving anxiety symptoms, but their prolonged use can have severe consequences for brain health. Besides memory loss, long-term use is linked to sleep problems, anxiety, muscle weakness, and dependence, making it difficult for patients to stop using these drugs. The relationship between benzodiazepines and Alzheimer's is particularly concerning, as it is believed these drugs may interfere with neurotransmitter function and disrupt sleep cycles vital for memory consolidation. Doctors should consider non-pharmacological alternatives for treating anxiety and insomnia, such as cognitive behavioral therapy and relaxation techniques. When benzodiazepines are necessary, they should be used for short periods and at the lowest effective dose. Fifth, let's consider amphetamines and the memory trap. Amphetamines, including the popular Adderall, are widely used to treat attention deficit hyperactivity disorder, ADHD. While they can improve concentration and reduce hyperactivity in the short term, prolonged use can have significant adverse effects, including memory loss.
Amphetamines work by increasing levels of dopamine and norepinephrine in the brain. However, continuous use can lead to dependence, sleep difficulties, irritability, and even depression. High and prolonged doses can cause permanent brain damage, with memory loss, decreased motivation, and lower cognitive performance persisting even after stopping the medication. There's also a risk of abuse and addiction due to their stimulating effects, leading to serious complications like cardiac arrhythmias and even sudden death. To minimize risks, amphetamines should only be prescribed and monitored by healthcare professionals, with strict adherence to recommended doses and consideration of behavioral therapies as alternatives. Sixth are first-generation antihistamines, relief today, problems tomorrow. Drugs like chlorpheniramine and diphenhydramine are widely used to relieve allergy and cold symptoms. While effective for immediate relief, these medications can have long-term adverse effects on memory and cognition due to their anticholinergic properties. Prolonged use of first-generation antihistamines is associated with an increased risk of dementia. A recent review of 138 studies found a strong association between prolonged use and cognitive disorders. Safer alternatives, such as second-generation antihistamines like loratadine and cetirizine, offer effective symptom relief without the same risks to brain health.
Seventh, and this is the most dangerous and least known, are tricyclic antidepressants. Medications like amitriptyline and nortriptyline were some of the first developed to treat depression. While effective, they have strong anticholinergic properties and are associated with memory loss and other cognitive problems. Regular use can cause concentration difficulties, confusion, and both short and long-term memory loss. Today, safer alternatives such as selective serotonin reuptake inhibitors, SSRIs, are available, which are not associated with memory problems and have a better safety profile. Finally, eighth on our list are statins, the paradox of cholesterol and cognitive function. Statins like atorvastatin and simvastatin are widely prescribed to lower cholesterol and prevent cardiovascular diseases. While they protect against heart attacks and strokes, some evidence suggests that prolonged use may have adverse effects on cognitive function. Although not common, memory problems and mental confusion have been reported. Statins may interfere with cholesterol production in the brain, essential for cognitive function. To minimize risks, patients and doctors should discuss potential side effects and monitor cognitive symptoms, adjusting the medication if necessary. Self-medication and prolonged use of certain medications can have significant adverse effects on memory and cognitive function. We've highlighted how common drugs, including omeprazole, anticholinergics, corticosteroids, benzodiazepines, amphetamines, first-generation antihistamines, tricyclic antidepressants, and statins, can harm the brain in the long term. It is crucial to always consult your doctor before starting or continuing any medication. Informed discussions about risks and benefits, as well as exploring safer alternatives, are essential for protecting your cognitive and overall health. Thank you for joining us today. If you found this information